to share with you a very quick sequence. It's very good if you've got sacroiliac issues, sciatica symptoms, instability in the pelvis, and you just want to increase your flexibility in the hips. So the first posture we're going to do is eye of the needle, seated, or some might call this figure 4. So start with your knees bent 90 degrees. You're going to cross one ankle over the other knee, and then you're just going to take the knees to the side. You come back and take the knees to the other side, and continue like this. So we're just getting our internal rotation, external rotation. Do a few on each side, equal number on either side, and then you're just going to push your chest forward and hold the pose. You can back off a little bit to go deeper. You're going to bring that front foot in towards you, and this is going to make it deeper for you. Change to the other side, do the other side. So ankle crosses over, take the knees to the side, come back to the center, to the other side. So just going backwards and forwards, and then if you want to, you can just hold the stretch over at least 20 seconds. I've got my trusty spiky ball here. If you want to go deeper, place the spiky ball underneath the hip. It's very good for piriformis. Ooh, and take it over, and then yeah, you got it. Okay, good. And hold for about 20 seconds. So after that, we're going to do sacroiliac, which is basically cow into child pose. So hands under the shoulders, knees underneath the hips. This is going to warm up the spine, the lower back, and through the glutes as well. So inhaling, bring the chest forward. So this is going to extend the spine. Round the back, draw the belly and chin to the chest. So arch your back up and begin to take your bottom to the heels. The elbows come down and the forehead comes down. So this is very easy for me. It may not be for you. So you just work within your limits. And if you find it hard to sit down onto your heels, you're just going to go within your range of motion and until you can get all the way back. So very nice to extend and flex the spine, stretching the hips and the lower back. Do that a few times, and then you're going to come to the center. You're going to take your left knee to the right knee, like so, and you're going to move your hips to the right. So you may not feel anything here, so in which case take your hips back, take them forward just until you find that sweet spot, and then you're just going to hold it there. And you can do little pulsing movements, not bouncing, just gently moving in and out of the stretch. Going forward, going back, just looking for that sweet spot. Come to the center, change, so come back to all fours, right knee to the left, take the hips to the opposite side. Again, you may not feel anything here, so you move until you find something. And then just moving backwards and forwards, maybe in and out of the stretch a little bit. And then again, hold the stretch 20 seconds, 20 to 30 seconds, longer if you want. Come back to the center, so we'll do one sacroiliac just to make sure everything's evened out. And the next one, sacroiliac again, but this time we're going to take one knee back slightly. Now it doesn't have to be too far back, 10 centimeters will do it. So we're going to do the same movement, so inhaling, round the back as you exhale, begin to take your bottom down. Now keep your hips level, so you may not get your hips all the way down. And now I've got a big stretch down the right side of my back. Coming forward again, inhaling, round your back and exhale. Again, keep the hips level, try not to let the hips go off to the left, round your back, go back. One more. Coming back. Bring your knees back to parallel. Take the left knee back, same distance. Inhaling and exhaling. So big difference for me, one side to the other. Inhaling here and exhaling. And one more time. Inhaling and exhaling. You can do this as many times as you want. Bring the knees back to parallel. One more just to even everything out. If you do have sacroiliac pain, if you do have sciatica symptoms, You may want to do one side more than the other. If it's sacroiliac pain, probably you're not going to do the side more where there is pain, because often where there's more pain, that means there's more movement there. So maybe do the other side a bit more. And when you're moving into this, doing these stretches, there shouldn't be pain. Okay, you want to feel a stretch, you want to feel an opening, but no sharp pain. Okay. Now, the last one we're going to do is call it baby pigeon. So with pigeon, you've got the one leg back and one leg forwards, and the front leg's normally at a right angle. We're going to keep the back leg floppy, so we're not interested in the back leg, because one of the things with pigeon that's difficult is the hip extension on the rear leg. So we want to stretch open our external rotatus on the front leg. So I want the spine to be in line with the lead leg, and this heel can be in or it can be at right angles, that's fine. Fingers to the floor, so extend the spine, lift the chest. Very simple, come down over so your spine is in line with your lead upper leg, with your lead femur, and just rest your head down. So here, this should feel like nothing. Okay, you want to drop as much of your weight down into your lead leg, into your hip, and into the floor as possible. So this should be very relaxing. The more you relax here, the bigger the stretch you'll get in your right hip. And even now, I can feel a decent stretch into my right hip. So again, if you've got sacroiliac issues, you know one hip's tighter than the other, this is a really good thing for you to do. I'd say for piriformis type syndrome stuff, you probably do want to stretch the tighter side more. So maybe start with that, do the other side, and go back to this side again, the tight side for piriformis issues. And hold for 20 seconds minimum. This one is quite soft. It's a yin type thing. You can hold it up to 5-10 minutes if you want to. Okay, but again, no sharp pain. Okay, so to finish, just to square everything off, one more Chakrapakasana. And then come up to sitting. Okay, good. So I hope you enjoyed that. Please like and subscribe for more videos. Thank you.